meeting, and as you will see from the screen, I was asked to talk about governance for global health equity in a turbulent world, and certainly we have a turbulent world today. And more specifically, I was asked to address my perspectives on best practices for structuring partnerships between academia, policymaking institutions, and the private sector within the global health space. And I should say immediately that what is so important now in the time to come is that academia, but also NGOs, the civil society, take responsibility for trying to fill in where we see that many nations, including the US, of course, withdraw from the multilateral space for global health. It's a critical situation now in many parts of Africa, not least, where the dismantling of USAID and also the US withdrawal from the World Health Organization creates significant health problems. And I am myself working also in Africa, and I can see close range the enormous challenges that we have at the moment in the realm of global health. So my suggestion to policymakers and EU policymakers not least is that when we now shall realize the ambitions in the EU global health strategy, we must ensure that the academic networks and also the NGO networks will be able to operate as efficiently as possible through funding and through investments in these networks. So it's a very serious situation, and I will give my more or less overarching reflections on the situation that we find ourselves to be in, and point to some possible solutions that really require academia and NGOs to step up to the current situation. So I have many different hats when it comes to global health, as you can see from this particular slide. I am the former president of Karolinska Institutet, University of Oslo, where we were very active in the field of global health. And also, as was pointed out, I'm a part of the One Sustainable Health Forum, and also the One Europe for Global. And in this commission, we are really zooming in on some of the issues that we are discussing here. How should we sort of restore the multilateral space for health in this very critical situation that we are facing today? We have to create, as we say, policy space for health to really step up for these very, very important challenges that we're facing now. And the third slide gives us some of the reflections that we put to paper in a recent recent article in the British Medical Journal. We have to fill the funding voids that now challenge many populations on Earth. And to do this, we have a number of different suggestions. You can read this paper, and what is a commonality when it comes to these suggestions is, as I said, that academic networks must step up to the challenge in collaboration, of course, with NGOs and also with the private sector. We saw during the COVID-19 pandemic that the current global governance system is in many ways not able to deal with challenges on the scale that we saw with COVID-19. So we have to look ahead also for a new, what we should call a global governance structure or architecture to really enable us to better meet future challenges in the form of new pandemics or also in the form of other crises like the climate crisis that now is looming large. So in fact, what we need to do, and that is the most important thing to point out, is that we have to work together on two different time perspectives. We have to fill the void after the withdrawal of the US and other nations when it comes to multilateral organizations, but also we have to look at the future for a better global governance architecture to ensure that we can prepare for new health crisis in an appropriate manner. So what we did at Karolinska Institutet is something that I think we should all be aware of. We have to, in academia, to build equitable partnerships with institutions in the global south. And equitable partnerships means, of course, that we must be attentive to the strategies and the needs in the global south and work within the strategies of our global south partners. And in this paper, we outline some of the principles that I think will be important for forming such equitable partnerships in the time to come. This is a partnership we established between Karolinska Institutet and Makerere. So one example that I will put forward as to how academia, in collaboration with both private sector and NGOs, could help realize the ambitions of the EU Global Health Strategy. That's what we did together with Africa CDC, Centers for Disease Control, and also then Charité in Berlin. What we did was to arrange for a seminar series on vaccine uptake to see what is needed from academia, not least, in order to build a viable ecosystem for vaccine production and uptake in Africa. This is, of course, very much needed. As you know, at the time of COVID-19, just 1% of the vaccines, all vaccines taken together that were deployed in Africa were in fact produced on the continent. And the situation is not very much better now. So there is a dire need for increasing the capacity for vaccine, but also medicine production in Africa. And what we did in this seminar series that extended over 6 months last year. So these are the different topics that we analyzed. The aim of this seminar series was, in fact, then to identify voids and obstacles that we need to deal with in order to provide for a vital ecosystem for vaccine production and uptake in Africa. And as you can see here, we engaged not only academic partners, but also partners from the private sector and also, of course, health organizations at different levels, including the World Health Organization. This is the kind of approach, I think, that is so important for the future, that we try in collaboration with all the different sectors involved, that we try to identify the voids and obstacles that we have to remove in order to build capacity for vaccine and medicine production also in the global south. This is the only sustainable strategy for better health in the time to come. And just to come up with one figure that tells you what kind of challenge this is. When we look into the African vaccine strategy, what they have done is to map the capacity that is currently available. And it's quite clear that we need to ensure that capacity is being built in order to come up to, as it says here, at least 12,000 full-time employees to realize the ambitions of Africa to produce 60% of its own vaccines by 2040. And of course, this cannot be done in isolation. It has to be realized through academic partnerships where also the global north contributes appropriately. So over then to the One Sustainable Health for All, the One Europe for Global Health Coalition. So I can't go into very much detail on this because of the time constraints, but I will give some highlights. And I guess Brian Rudkin had a short intervention yesterday about these two networks. And these two networks have different aims. One, Sustainable Health for All, is very much about understanding, to advise and operationalize on the global health, and particularly the One Health aspect of global health, while the One Europe for Global Health coalition is very much set up to advocate for global health and One Health by, for example, contacting, discussing with policymakers at different levels. And the four main aims of these two networks is, of course, to increase the public knowledge of the challenges in global health and One Health, to see to it that we have more financial support, and also to look at what are the data that we need to really improve on global health and One Health. And finally, also, we are looking at the governance structures at different levels to ensure a better global health and One Health strategy. And just last week, we had a meeting also with the quadripartite partnership. As you know, different organizations within the UN system are now working together for the betterment of global health, and particularly the One Health strategy. So it's very important that academia, that all of us also are active in what we could call the vertical dimension, addressing global governance organizations and also policymakers at the national level, regional level, and the global level. And we have been very, very active when it comes to the One Europe for Global Health coalition. As I pointed out, one of our missions is really to contact policymakers, to advocate for health. And for each new presidency of the EU Council, we have approached the EU Council with our requirements, with our suggestions and recommendations for better global health and One Health. And it started already in 2022, where we addressed these issues in a meeting with all the health ministers from the EU member countries. So this is just an example how we try to provide recommendations for policymakers. This is a paper we published in the British Medical Journal, where we point out what is needed in order to ensure that EU global health strategy will be a success. Finally, I would just like to say that one of the most important steps that we are pursuing now in the One Sustainable Health Forum is to work on all the different aspects of global health and One Health through 10 different working groups, addressing all aspects of health, from environmental health through One Health in urban settings, as is said here, all the way up to digital health and governance for health. And we are, of course, very active when it comes to meetings. We have meetings under the World Health Summit, like we had last year, where we discussed One Sustainable Health Institutes as a sort of way to go in order to secure that we have an appropriate One Health focus in global health, addressing not only human health, but also animal health and planetary health. And of course, it's very important to involve the private sector in all this. And this is just an example how we at the Karolinska Institutet invited the major players in the private sector when it comes to vaccine production to see how we could come up with collective efforts, joint efforts for providing production facilities for vaccines also in low and middle income countries. There is one very, very important challenge for us as academics, and that is simply data. Because if we are going to make progress in global health and in the One Health domain, we need to be much better equipped to assess data, to access data, and to structure data for better governance. So this is one of the papers we published not long time ago, where we realized that we have a long way to go until we have sufficient data for improving global health and One Health. And also, we should not forget how important it is to implement all the knowledge we have, including the knowledge as to how we could use vaccines efficiently, also in low and middle income countries. So the Nobel Prize in Physiology or Medicine in 2023, as you know, went to those who were critically involved in the development of new vaccines, mRNA vaccines. But we should be reminded what Nobel said, and that is that, yes, the prize should be awarded to distinguished scientists, obviously, but he also said that everybody should benefit from the fruits of science, and we are a long way from that particular goal. So the final slide, I would like to go back to a speech that reminds us all about the importance of solidarity when it comes to global health. And this was the speech that was given by John F. Kennedy in 1961. In fact, just as starting point for the establishment of USAID, that is now being dismantled. And what he said in this speech, and I think this speaks to us today as well, and that is that we have to be aware of the fact that we are just one humankind, and that we have to appreciate and acknowledge that values, security, prosperity are inextricably intertwined. And this is a speech that I think we should take to pay attention to even today, when we see that these ideals are not any longer honored by many countries in the world. So I would like to say thank you to all of you. This is just a final slide which shows some of the multiple academic and organizations and NGOs that are involved in this work. And I do hope that all of our friends and colleagues in Poland also will increase their efforts in building a sort of alternative to those organizations that are now deprived of their funding because of this, I would say, very sad development on the geopolitical level. Thank you for your attention.